Hi, my name is Lucie. I'm the Executive Director of the St. Lucie County Health Access Network, also known as the Hands Clinic. I have been the Executive Director since April 2020. I came for the pandemic, and we have been working really hard to help our community make it through these trying times. Our mission is to provide free healthcare to low-income, uninsured adults in St. Lucie County. So this is our clinic. We're located at 3855 South US 1 in Fort Pierce. We see people from all across St. Lucie County. So in the beginning of the pandemic last March, we made a decision to stay open and stand our ground during the entire pandemic. And it was actually a good thing because we were able to meet a lot of our different not-for-profit partners in the area. We worked with the Treasure Coast Food Bank in order to do food distribution. We've done COVID shot vaccinations. We work with other not-for-profits in the area to ensure that their individuals that they're seeing are well taken care of during the pandemic. Staying open was definitely the best strategy. So this is our medical area. This is where we see patients. We have 8 clinic rooms, but since the pandemic, we've upgraded all of our technology and we have telemedicine available to our patients who may not be able to come in. This way. This is where we see our patients. Depending on the number of practitioners, depends on the number of appointments that we can offer during the day. All of our doctors are volunteering their time in order to see the patients within the clinic. We have 8 medical rooms. We have 4 dental operatories, a full sterilization room so nothing needs to be subcontracted out, panoramic x-ray machine. We also receive some angel funds, and we are working on putting dentures into our patients' mouths. We're even able to provide a lot of specialty care. So for example, we have this beautiful eye room. A lot of our individuals are very brittle diabetics and have eye conditions. We're able to work with them here to make sure we keep their sight on track. We also partner with the Lions Club if the individual has glaucoma or needs cornea surgery. We also have a chiropractor. Say hi. Hi. We are a volunteers in medicine clinic. We have an average of 14 volunteer doctors at any given time. They volunteer their time to see the people in the community who have almost no place else to turn. Volunteers make this whole place work. Volunteers and the people in our community that care about our neighbors. We have relationships with all the local hospitals and multiple specialty practices. So we're able to work with them to provide a continuum of care for our patients. So it's not unusual for somebody to come in, need a mammogram. We work with a partner in the area. If the diagnosis is different than what we had hoped, we can help them access the care they need for their best outcome. Our average patient has between 2 and 5 chronic conditions. It's a sad fact that when an individual seeks our care, it's generally because they're very sick. Not a lot of people come to us because they want to prevent their next illness. It is one of the best parts of my job that I get to see the patients in the beginning when they're scared and sick and feeling poorly and watch my team help them get back to the best health they possibly can. Our patients are the people who build your homes, serve your coffee, waiters, waitresses, frontline staff at Walmart. Our average patient, a single individual, earns less than $25,000 per year.
Do you have a success story with the Hands Clinic?
Yeah, actually I do. I'm a stroke and seizure survivor. It happened in 2018, and the Hands Clinic was really there for me, still is here for me. The bills would be phenomenal if it wasn't for the Hands Clinic. I'm able to be seen the way I need to be. And for people that are in my shoes that have a lot of health issues that can't get insurance, the Hands Clinic definitely steps up to the plate. I have to give them that.
I'm Catherine Hensley.
And can you give us a little bit of background about yourself?
I have been a community activist no matter which community I've lived in. We moved here in 1983 3, and I got involved with the community as soon as we moved here. Both my husband and I did. So I have served on many, many boards in this community. I went from 22 boards. I'm down to, I believe, 9 right now. But my whole passion is for children and families and the future of my community.
I'm Mike Brown Sr., and I'm a board member of HANDS, and I'm a retired banker and longtime resident in St. Lucie County. I came to St. Lucie County in 1974, worked in Fort Pierce from 74 to 2018, and retired in 2018. Local banker, love the area, love Fort Pierce. It's been so good to me. I'm glad to be able to help somewhat with HANDS and other organizations.
My name is Dr. Kenneth Palestrant, and I've been here in St. Lucie County for almost 30 years, practicing medicine in different avenues. And one of my favorite things is coming here and being a volunteer physician at HANDS.
I'm Gene Manco, a physician, retired 1 year ago.
I'm Linda Manco, and I'm a retired registered nurse 1 year ago.
We happen to be married
Yes.
for 51 years
Yes, we are.
to each other.
And you please tell us a little about your background.
I trained at the University of Pennsylvania, and I went into a residency at Penn State University in OBGYN. We practiced up in central Pennsylvania for a number of years and then relocated to Florida in 1981, at which point I became very interested in infertility, reproductive medicine, and the final years of my career, I spent 11 years with IVF Florida, doing infertility and IVF.
I am a graduate of the University of Pennsylvania School of Nursing. I am an OR specialist. I went back after having my children and staying at home for a while and took a course to become a registered nurse first assistant. I have been working with my husband, Gene, consecutively since 1988, after my hiatus when I had kids. I assist in the OR. I actually set up and ran the IVF practice for many, many years before we merged with IVF Florida. For some reason it works for us. I know it doesn't work for everybody, but for us it works. And that's basically my education and experience.
How did you become aware of the HANDS Clinic of St. Lucie County?
I've been in this community for probably 30 years, and in many different facets of medicine, emergency medicine, and urgent care. And I was aware of the HANDS Clinic development when they first started almost 10 years ago. So I kind of followed it from its inception.
Many years ago, there was a task force that was put together of community members to look at what was needed for the health community, I guess you'd say, of St. Lucie County. We knew that we had a lot of people that were uninsured. They may have been employed, but they were uninsured. So the health department seated a committee, and out of that long, many, many months discussion came the opportunity to create this clinic, which was named HANDS.
We had received our vaccinations, and one of the nurses, while we were being observed for 15 minutes, talked to us about volunteering. She passed her name on to Lisa Hatch, and Lisa called me and convinced me to come on down, take a look at the clinic, and see if I would like to participate and to assume the chief medical officer position here. And after being here for just a few hours, it was obvious to me that it's a wonderful team that they have here, like-minded people that are giving back to the community and patient advocates, and I jumped at the chance to help.
Well, actually, I had heard of HANDS, but I really thought it had something to do with people's hands. But I was invited to lunch by a friend of mine, Dr. Andy Passari, who was a former director of HANDS, and he asked me if I would consider being on the board, told me more about it, explained its mission, and talked about what it was going to do, and I agreed to do so. I've been on the board since then.
Why did you decide to volunteer with the HANDS Clinic?
Actually, being on the board was an opportunity for me. I've been on a number of boards over the years in the area, and they've all been rewarding for me and hopefully rewarding for the organization. But Hands struck me as an unusual situation where you were really helping a group of people that were hardworking but didn't make enough to be able to afford some of the medical care they needed, but they made too much to get it free from the government. So I thought it was a great opportunity to help people who were working and helping themselves, but just needed that extra bit of help with their medical care. And I later learned how much they leveraged the money they raised and the money they needed to operate with all the volunteer work and the donations from help from hospitals and the physicians, and the nurses. It's just remarkable how they leverage their finances.
And what do you both think is the greatest contribution the clinic makes in this community in St. Lucie County?
It clearly serves a purpose and a need for those who cannot afford insurance and do not have insurance. And that's very, very important. Unfortunately, we have a system that does not take care of those in need. We have a lower than poverty level of this in this community that really needs the assistance, and that's what's being provided here, both medical and dental and emotional, with some counseling as well. And everybody should be able to have health care, and not everybody can afford it. So it's really great that this clinic provides it.
I see an additional advantage in that, people who have no health insurance, they run to the emergency rooms when they have a problem. It's a drain on our system. It's not cost effective. And the Hands Clinic provides that stepping stone where people should not be afraid to come in. It's free care. They can be seen by physicians and nurse practitioners, qualified people. They can be directed if we need to refer to those specialists in the community if necessary. But we can deal with most of the problems here, and saves the emergency room visits that are unnecessary.
Knowing the demographics of our county and the demographics of our clients here, it is essential that this operation continue and become even more robust, because what we are doing is keeping employed people healthy and helping people that are not healthy become healthy so they can become employed. Many of our clients actually are employed, they just don't have insurance. So they need a medical home, a facility that can help them be well, and so they can stay employed while we're working in our community to make sure that everybody has the opportunity for a home health care.
And what, in your opinion, is the biggest need that the Hands Clinic can utilize?
Volunteers. We need more volunteers. Obviously, funding is very important. Nothing is free for us. I mean, we need funding to be able to provide the services, not necessarily for the professionals, but there's equipment, there's rent, there's a lot of things that go on behind the scenes. So funding and volunteers, we can always use volunteers, dental volunteers, medical volunteers, even non-medical volunteers. There's always a place for someone.
Yeah, part of my role, I think, is to access the network of clinicians that we have available to us, to see if we can get them to participate in this adventure that we're doing. But certainly we need the sustenance of financial backing with grants, with foundations, with donations, all the above, to keep us running and keep us seeing patients.
What is the biggest need for Hands right now? I think it's hard to say one. I think continued volunteer for the medical community, which they're getting, and it continues to expand, but they obviously from time to time need additional specialties. I think we need over time to attract more long-term sustainable sources of funding. We're doing a good job of that now. We're making progress, but this is an organization where the need is going to continue. This is not an organization where they're going to find a miracle cure and we won't need to take care of people, but general health care is going to be critical for a long time, and Hands is uniquely poised to help.
Well, when I was the director here, I would tell the staff that at some point it would be good if we didn't need the Hands Clinic at all. And they would look at me with open, bugged out eyes and like, what do you mean? You know, and what I meant by that is that if we didn't need a free clinic, it means everybody had some sort of health care coverage. I think that is not going to happen. It's never going to happen. You're always going to have people who are going to be outside the safety net. I think that there's a lot of very effective and good not-for-profits in every community. Being a physician, my inclination is towards healthcare. I think that obviously not just better funding, and when I say better funding, having a continued funding source. Our county here has been very generous to the Hands Clinic. They give us a significant amount of funding via grants on a yearly basis. There are some counties that have bigger populations that actually have a healthcare district financing through taxation, even a small amount, because we need to take care of our people who cannot afford health insurance. And I also have to say that the local community, the hospitals, have put in a significant amount of effort in supporting us here with the health care that they provide. But I think the most important thing, in addition to having money to be able to pay for it, is also getting the word out there that our clinic is here, that we're available, and we're here ready to see patients.
It's a dedicated team, highly credentialed, all people whose hearts are in the right place. They're retired, but they want to give back. I've sort of seen some patients with them. The caring that they give patients is just outstanding. It's even better than I see in private practice, because they're not encumbered by all the charting and all the medical liability issues. They're actually giving them themselves, and the patients appreciate every moment of their time. And it's just a beautiful experience.
There's one patient I can mention in particular, which I think is very interesting. It was when I first started here. She was in her mid-50s. Unfortunately, she was an alcoholic who had reached the end of her rope. Came to us from the hospital, had been discharged, was in the intensive care unit for almost 10 days, was at near death's door basically when she came in, had all of the manifestations, the secondary manifestations of alcoholic liver disease and you name it. And I met with her and we sat down, and I basically told her, I said, if you don't quit drinking, you're going to die, and you're going to die a horrible death. It's not a quick way. It's a horrible, horrible way to die. And she was on a slew of medications that had been seen by all kinds of specialists, because the ravages of alcoholism cause all kinds of processes within your body, your liver, your blood system, your brain, you name it. And I started seeing her. She quit drinking. She would come in on a regular basis. As time went on, you could see the transformation. She looked better. She would take better care of herself. We were able to reduce her medications one by one over a period of time. She actually was on a liver transplant list. That's how bad she was. And we had communicated, well, she had communicated with the transplant people up in Orlando, and was actually set to go up there to have the transplant. And then she started getting better. And right around this time, she actually came in one day and she goes, I can't see you guys anymore. I've got health insurance. So we don't take patients who have health insurance or Medicare or Medicaid. These are for the people who do not have any type of health coverage. And I said, great, I'm happy. She looked so much better. And then fast forward a year, I was at the gym in LA Fitness in Jensen Beach, and somebody talked me into doing a spin class, which I normally don't do. And I'm on this bike, and when you're on this bike, it's kind of boring, and I'm looking in the mirror, and I see this woman that I'm like, where do I know her from? She looks very vaguely familiar. And finally it clicked, and I said, that's Shannon, that was her name. And I couldn't believe it. And I went over and I said hi to her. She knew who I was. And she had, her liver had recovered. She was off the transplant list. And here she is in a spinning class, exercising, you know. So that was a really unique experience. I think we made an impact, turned her life around, and certainly, you know, we did turn her life around. And we do that on a regular basis here. There's a lot of very, very complicated patients that come here, people who are very, very sick, and the mission here is tremendous. And the people are so appreciative, so appreciative of what we offer, what we have to offer to them.
We've learned the fruits of volunteering for many years. We have done medical missions to Honduras, where Linda and I went with our surgical team, and we performed surgery on patients who had no access to medical care in Central America. It's a wonderful feeling to give back, use your skills to help other people who would otherwise never get access to care. And as Lisa Hatch said to me, she said, you don't have to go to Honduras to do that. You can do that right here at the Hands Clinic. And indeed, that's what we would like to do, to give back to our community all of the skills that we have.
Even though our budget, we managed to keep our budget at or below $800,000 per year. Our valuation report shows that our services save the county and the state over $17 million per year. We manage the chronic conditions that send people who are uninsured into the emergency rooms. And we also provide free prescriptions for our patients. That averages $200,000 per month. So we give away $200,000 a month in free medications.